There's other examples. There are a lot of people out there who have mild delusional disorder. Delusion is simply a belief that cannot be true or is not true by any consensual agreement. And for example, very hardcore conspiracy theorists often believe things that are not true, that cannot be true. Yet they function. They're not disabled by this. So, do they have a psychiatric disorder? Some people would say yes, some people would say no, and the DSM is unclear about it. So, I want to talk to this group mostly about mood disorders, okay, and how they're diagnosed in the differential diagnosis. There's other kinds of disorders in the DSM, all kinds of other disorders. There's psychotic disorders, there is substance abuse disorder, you can go down and name them all, but mood disorders, the most significant mood disorder statistically that causes probably more pain and suffering and economic loss than any other psychiatric disorder, and it's probably first or second for any medical disorder, is major depression, unipolar major depression. It's common. It's the common cold of psychiatry. Unfortunately, it does not go away often like the common cold does in a week or two. And it can be very nasty. 15% of people who have one or more episodes of it die by suicide. And, there's not that many medical conditions that cause death 15% of the time. Furthermore, if you think about it, people commit suicide not because they're in a lot of physical pain or with a medical disorder, so much as emotional pain. That's how nasty it is. It's one of the nastiest disorders on the planet, and unfortunately it's common. Over a lifetime, 10% of men will get it, 20% of women. Why do women get it twice as much? I'll leave that one open for discussion. The answer is not known. Many people think it's hormonal. Obviously, hormones are different in men and women.
You report more on.
Yes, men and women often have different defense mechanisms, so men will defend, for example, against the sadness of major depression with anger or irritability, and so on. And so, just to let you know, in patients with comorbid chronic medical conditions, like heart failure, something that they can feel, a pain disorder, something that causes pain, the risk is doubled. People with those conditions, the risk for men is around 20%, and the risk for women is 40%. So, in general medicine, internal medicine, major depressive disorder is seen a lot. Most treatment is done by primary care physicians, not psychiatrists, not psychotherapists. Primary care physicians instead treat it with medication. Now let me talk a little bit about how this diagnosis is made. There are 9 criteria listed in the DSM. The thing has to last for at least 2 weeks. If it's under 2 weeks, it's not major depression by definition. Okay? If it's been going on 2 weeks or more, and sometimes it can last untreated for months or years, you have to do, in order to make the diagnosis, have depressed mood, blue, sad, and so on, or a loss of things that used to give you pleasure or that you were interested in. Often I'll just ask, have you felt sad? Or what do you do for fun? someone in a major depressive episode will say, I don't know, I don't do anything for fun. Can't remember. Or, yeah, I used to do this, I used to like to ski or read books. Now, I don't do anything for fun. That's common. You have to have one of those two to qualify, or both. So interestingly enough, major depression can be diagnosed without the depressed mood or the sadness. If you have the loss of interest plus 4 others, and you have it. Now that's not common, but I've seen it, and a lot of times it's missed because of that. People state that they're not sad, they're not blue, they're not down in the dumps. They may have major depression going on anyway. Some of the other criteria, which I'll just go through briefly because it gets kind of boring to go through these lists. Weight loss or weight gain that is significant. Sleep disturbance, meaning insomnia or just sleeping all the time. Psychomotor retardation or agitation, meaning you're shut down physically or moving around a lot. Fatigue, feelings of worthlessness or guilt, problems with your memory and concentration, and thoughts of death or suicidal thoughts or actions. Okay? I think that's all. So you have to have 6 total. And you have to exclude other things, which is where the differential diagnosis comes in. I'll just mention some of the chronic medical conditions that increase your risk for this. I mentioned heart failure, stroke's a common one, cancer, diabetes, emphysema, pain disorders. All of them increase the risk. Now, sometimes you can qualify for this and have all the symptoms that I mentioned, or 5 out of 9, but the depression is caused by a medical condition. Okay? Some people with MS, for example, are very susceptible to becoming majorly depressed. You can't really call it major depression. You call it mood disorder with depressive features secondary to multiple sclerosis. Okay? So sometimes, if you can treat the underlying medical condition, the depression will go away. And it's quite common for there to be thyroid problems causing a mood disorder, either manic or depressed. And when you treat that thyroid condition, the mood disorder goes away.